So let's start about this Fauzia sheet 2 illustrated. There are around 177 questions. We will just read it and with explanation and see the time, how much time it takes to cover this. First question is regarding 26-year-old man motorcyclist loses 1 liter of blood secondary to open fracture of the femur sustained road traffic accident. Which of the earliest? Whenever there is trauma, earliest action to come is baroreceptors. How? Blood loss is there. This detected by arterial pressure, decrease in arterial pressure, decrease in, so it stimulates the baroreceptors which is situated in carotid and the aortic arches. They are stimulated and that causes immediate cardiac stimulation, vasoconstriction, systematic vasoconstriction. These two increase in blood pressure. So baroreceptor first to come in action. Histology. Second question is histology of discrete lump in the breast. Breast lump, 34-year woman, apocrine metaplasia. This is nothing, a simple thing. Epithelial overgrowth, papillary projections. There is no feature of malignancy. So carcinoma is out of question. Fibroadenoma is also not clear-cut visible. Fibrilloma mastitis. So this is a benign cyst. Apocrine is generally for the benign. 35-year woman presents with recurrent peptic ulcer. Age is 35, recurrent. Again, proton pump inhibitor is given. H. pylori eradication is already given 3 months course ago. So cholecystokinin, histamine, pancreas secrete not related, gastrinoma. You can see Zollinger-Ellison syndrome is gastrinoma, peptic ulcer disease 95% is there, and hypersecretion of the gastrin is there. It causes stimulation of the parietal cells to stimulate to release gastrin, this hydrochloric acid. The fourth question is 3rd-year-old male boy. Age is only 3 years. Mother of rectal blood loss. Mother describes bright red in the toilet pan. So whenever bright red toilet pan, jewelline polyp. Peutz-Jeghers, multiple polyps has to be there with some changes on the face, and there is 32-year-old man presents with painful torticollis. This is sternocleidomastoid supplied by accessory nerve. Trapezius and sternocleidomastoid supplied by accessory nerve. A thin menopausal patient is thin, menopausal, 52 years old woman diagnosed of breast cancer is already diagnosed. Menarche is 14 years, menopausal, first child. This is significant. Catch point is first child. So child at first full pregnancy. So high risk factors here is a first child. So if you see the risk factors, they are age of the child, relative risk, and high risk group. And these are the risk factors related to risk and high risk. So if you see high risk, menarche before, early menarche, late menopause. This is again is the hormonal status, oral contraceptive. These are the risk factors. You can see 10% elderly, and nulliparous first child in early 40. The risk is 3 times. Age is very high risk. So in this patient is 52 year. That's why age at full-time pregnancy. So what are the other options? Familial predisposition, interval between menarche and menopause. This is one of the second thing, but more is first-time pregnancy. So exposure to estrogen is important. So this is about. The next question is 30-year-old woman is sent to the outpatient clinic with weight loss of 5 kg. Age is 30 years. Weight loss is 5 kg. She has also complaint of anxiety, panic attack, and palpitation. There is swelling in anterior neck which moves with the deglutition. This is thyroid, and there is nothing else there. More likely. So what is anxiety, panic attack, palpitation? Palpitation is Hashimoto's, there is no hyperthyroidism. Metastatic hyper. So in this grave disease is hyperthyroidism. 69-year-old has age is 69 year, admitted high dependency following anterior resection until GA surgery is done. He was given 2 milligram intrathecal morphine is given. Okay. On examination looks pale, drowsy, arterial blood gases. What is there? pH is acidosis. First thing you have to see acidosis. Then partial pressure of CO2 and so if you see base excess, acidosis base excess, it is minus 2.1. I mean basis has come down, so it is acidosis. Metabolic, if you see only base excess, it is metabolic. Then you see PCO2, it is 8.1, means again that is acidosis. So what is happening? First PCO2 is raised and PO2 is normal. So person is given morphine. This is the catch point. Because of morphine, there is respiratory depression. So CO2 is retained inside and base is not compensating. If base has been increased, so it would have been respiratory acidosis with compensatory. So it is not compensated. Only option given is respiratory acidosis. Simple thing is morphine. Here you can see pH, PO2, normal has to be this. PaCO2, it's be 35 to 45, or here 8.1. So respiratory opposite is metabolic, pH is increased. PCO2 decrease means alkalosis, PCO2 increase means respiratory. pH is decreased, pH increase, respiratory. If it have been metabolic, pH is decrease and bicarbonate goes down, equal. 53-year-old woman with pigmented lesions excised from her calf. The lesion is pigmented from the calf. It's going towards melanoma, just melanoma in situ. Completely excised 1 centimeter margin is there. So what is there? How to manage melanoma? 0.5 to 1 centimeter is called as thickness, size or thickness in millimeter. Up to 1 centimeter, less than 1 centimeter. So it is the margin of excision if it is in situ, not involving the basement membrane. If it has gone up to 1 millimeter, 1 centimeter has to be the margin, and 1 to 4 millimeter, 2 centimeter, double it. More than 4, 3 centimeter the margin. So here excise is 1 centimeter margin is excise, and it is in situ. In situ. Here 1 centimeter is excise. So it is enough. Surgery is enough. Education, self-examination, discharging. A 60-year-old man with past history of angina. Man is 60-year-old. There is history of angina. Inguinal hernia surgery, post-op found to be hypotensive. BP is down. Heart rate is increase. JVP is increase. Whenever there is congestion, the blood is congesting in the right atrium, JVP is increase. What is the appropriate underlying cause? So BP is going down, heart rate is increasing. So it is some sort of hypovolemia. In that BP is going down. No, then there is, what is most likely underlying cause? Stroke volume. So stroke volume is decreased whenever the content is lost, but person is trying to increase. It may be the cardiogenic cause, it may be any cause, but BP is decreased means stroke volume. Cardiac output is always end stroke volume is equal to end diastolic volume minus end systolic volume. So diastolic means before pumping, this is after pumping. So how much blood is pumped in a minute in a single, this into heart rate will be cardiac output. So this depend upon decreased cardiac contractility. This is a cardiac cause. Decreases stroke volume and cardiac output. So decreased systemic perfusion, pulmonary congestion, decreased coronary perfusion. So this is cycle like this. A 4-year-old boy presents to emergency department with 2 day history of fever, difficulty in walking, unable to bear weight. 4 is the age, fever history is there for 2 days, unable to bear weight on right leg. Oral amoxicillin, chest infection is there, he is irritable with 39, he does not allow, keep his head. So this is infection. There has to be either transient synovitis or septic infection. As there is no any other about transient synovitis, septic arthritis is there. If there would have been temporary 1 or 2 days history actually and let light fever, let not much hip flex, that's why it is septic arthritis. Emergency department brain demonstrate extradural. Any extradural hematoma, it has to be medial meningeal artery, which is located at the pterion. Pterion is the junction of 4 bones. This is the frontal bone, this is parietal bone, this is temporal bone. Amongst temporal bone, squamous part temporal and sphenoid bone, greater wing of the sphenoid. 65-year-old man with a history of transient ischemic attacks, he is due to undergo carotid endarterectomy. Carotid endarterectomy. These are the carotid arteries. This common carotid, this is external carotid, this internal carotid, external carotid is immediately. Internal carotid is going inside and it goes inside the brain from the carotid canal and it gives, this is the pathway of internal carotid artery vertically upwards to the skull, then it goes into foramen lacerum, then first part, second part, third part, fourth part is passing through the so many, and then this gives the middle cerebral, posterior communicating, anterior cerebral. 6 angle bend of the internal carotid artery. Internal carotid artery is bending so many ways. So what is the question is that it is just inside, it is giving one branch, that is ophthalmic artery. Internal carotid artery has no any other branch. First is ophthalmic, then anterior cerebral and middle cerebral. Middle cerebral is the largest. 25-year-old male athlete standing at how many liters of blood is pumped per minute. So it's always cardiac output is stroke volume into heart rate. Stroke volume is actually end diastolic volume minus end systolic volume. So average 70 kg is giving 70 stroke volume is 70 into 49 is 500 liters. A 26-year-old man present to emergency department sustaining glass cut on his arm. On examination, 10 centimeter anterior aspect of the arm. He is symptoms of ulnar nerve injury. This are talking about arm. So this is the from here to here is arm. It's anterior aspect and around 7. So it has to be 7 like this. Explain upper part would expect ulnar nerve. If you see this, there is the brachial artery. Let's continue to the brachial artery down from the level of teres minor muscle, teres pectoralis minor. It is dividing into 3 parts. Then teres major muscle, lower part of teres major is dividing into connecting, making into brachial artery. Here you can see this lateral is the median nerve. This is ulnar nerve. The posterior cord, anterior cord. This axillary artery. This is called as these 2 cords. This is lateral cord, this is medial cord. These the 2 join together to form the median nerve. Ulnar nerve is continuation down on the medial side. This is musculocutaneous nerve. Ulnar nerve is always medial to brachial artery till its course. Even at the hand, ulnar nerve is always medial to ulnar artery. So ulnar nerve is medial to brachial artery. This is the level of inguinal 10th level of umbilicus, it is 10th vertebra. So dermatome is 10. If you want to remember these dermatomes, here is 10, inguinal region is L1 and sensory dermatomes T7 to L1. T7 is xiphoid process tip. T10 is umbilicus. L1 is inguinal fold. Innervate muscles, intercostal muscles, T7, T11, subcostal, lumbar. Next question is about 65-year-old man complains of thirsty. What are the catch points given here? He want to get up middle of the night for toilet. His weight is 95 kg and height is 1.65. Blood pressure is normal. Oral glucose tolerance test is giving the figure 5.9 and GTD after 11. The normal values has to be this 11.3 is higher, 5.9 is okay. So impaired glucose tolerance normal, it is fasting 6.9 up to 6.1 to 7 is to be normal. So this has come normal, but you see impaired glucose tolerance 11.1 is supposed to be higher level. Above this he will be having diabetes. So more than 11.1 is, it is 11.3, and more than 7.8 is diabetes. 9-year-old boy with cellulitis of the hand, chronological sequence of immunoglobulin, AGM, me, I am first, you go. The M is first, G is afterward. Now this is 60-year-old man to emergency department, epistaxis. The source of bleeding is identified is little area. It has got sphenopalatine artery which is coming from behind, which is the branch of maxillary artery ultimately, and their anterior branches to be level. These are coming from the facial artery. These are ethmoidal arteries. They're coming from the above. Sphenopalatine artery is used for ligation. Old man present with esophageal reflex endoscopy reveals presence of hiatus hernia. It's VOI 8, 10, 12. Esophagus is 10, infravenica is 10, 8, and VOA voice of and 12 is vertebra. Aorta is 12, along with this phrenic nerve, along with this vagus nerve, along with this sympathetic chain. And thoracic duct is also 12. 78-year-old man with emphysema, 28% oxygen is given, blood gas analysis. So emphysema means respiratory. So what's happening? 7.28 person is taking not much respiration. So CO2 is retaining inside. So that is causing respiratory acidosis, trying to compensate. So bicarbonate has increased. So it is partially. If pH becomes normal, then it is compensated. Here is partially compensated, and mixed means if CO2, if PO2, here is respiratory, oxygen is less, CO2 is more, so it is compensation. 26-year-old man is having steatotic frame attached to the skull. When you are attaching the skull, this is one, this is one. So here is the branch, occipital artery. It is a branch of external carotid artery. This external carotid, posterior occipital. Another one is ascending pharyngeal. This is the branches of carotid artery. A 12-year-old man presents with 26-year-old, 2 months history of unilateral testicular swelling. Ultrasound shows heterogeneous mass. When the testis, within the testis and surrounding blood, shows elevated alpha fetoprotein. So in seminoma, there is generally no elevation. It is age group is 35 to 45. Teratoma is younger age persons are having teratoma. Combined this and alpha fetoprotein are increasing teratoma. And also if there would have been yolk sac tumors, then this teratoma. 2-year-old baby with increasing respiratory distress. He was born at term by normal vaginal delivery. On examination, there is cyanosis of the lower limbs and marked respiratory. His femoral pulses are absent. Anuric last 2 weeks. So what is this? This is the normal arch. If there is no arch continued, this is interrupted, means it has suddenly. So how person is living Ceylon pattern classification of interrupted. Ceylon pattern classification. Interrupted defined as complete separation of ascending and descending aorta. Type A is interpreted distal to supraspinal artery, ipsilateral to cerebellum below. So a person is not having femoral pulses are absent, and this baby is difficult to survive. Hardly can survive for 2 days. So, 50-year-old woman presents with a history of right upper quadrant pain and jaundice. She reports that her urine was dark and her stools are offensive. Dark color urine, offensive stools means there is obstructive jaundice. There is conjugated bilirubin. 26-year-old man suffers fall. Who had suffered fall? 80 years old woman has fall lying on the floor. She has been over 12 hours. Initially, she has core temperature. So here is increase. So what will be there? There is hypovolemia. Hypothermia will lead to vasoconstriction. Potential adverse effect: decrease heart rate. This, and you will get J waves in the ECG. 12-year boy, age is 12 year, 2 hours helping cut the grass, rhinorrhea. This is allergy, IgE. Allergy is for IgE. So if you see classification of hypersensitivity, 1, 2, 3, 4, immediately IgE, atopy and affects antibody mediated. B is second, 2 is antibody mediated. G and M, general manager, they are antibody. Immune complexes. So hemolytic anemia, blood erythroblastoma fetalis. This crosses, IgG crosses the placenta, leading to erythroblastosis fetalis. And immune complexes mediated serum sickness, Arthur's reaction, lupus. So this is IgG. Again IgM, IgG. M is first, G is next. Delayed hypersensitivity, T cell macrophages. 45-year-old man presents with back ache and leg pain due to prolapsed disc. Back pain is there, prolapsed disc. Now we have to measure the level. Pain which aggravates on coughing and radiates dorsum of the foot. There is weakness of dorsiflexion. You stand on the S1. So here plantar flexion is S1. So dorsiflexion is always less because dorsiflexion is done by the tibialis anterior. Tibialis anterior. So these are the muscles of anterior compartment of the leg. Dorsiflexion, and plantar flexion is by the posterior compartment of the leg. So when you see the thigh is supplied by femoral nerve, L234, femoral and obturator is L234. Then all the rest of the muscles are supplied by sciatic nerve, which has got combinations. Sciatic nerve is from L45S12, L2345S12. So this has to be L5, dorsiflexion, L5, plantar flexion, S1. So this is L4. This is figure to remember. This is pain, numbness, motor. Extension of quadriceps. So this is L2 is flexion of the, you start L2, L3, L4. L5 is dorsiflexion of great toe. L4, L5, S1. This is a nice diagram to remember. If you are extending the knee joint, extension of quadriceps, squats, rise, knee jerk, diminish, L4. So extension is like this, front, and dorsiflexion of great toe. It is going up to the toe, only toe, L5, and ankle Plantar flexion of the ankle down, S1. 75-year-old man who has carcinoma of upper rectum undergoes anterior resection at a supply of the upper rectum. So this you have to remember, inferior mesenteric artery is supplying to the rectum, upper rectum, sigmoid through left colic, and this is artery of Drummond up to the left 1/3. From here there will be superior mesenteric to the middle colic. So it is supplied by inferior mesenteric artery. 30-year-old man is undergoing abdominal aortic aneurysm. Stenosis demonstrated in lateral aortic branch arising at the level of body of second lumbar vertebra. If you see second lumbar vertebra, now this is celiac is around T12, just getting out of the diaphragm. L1 is SMA, superior mesenteric. L1 is superior mesenteric artery. So L1, after that there will be L2. So renal, so lumbar arteries. L1 again at the second lumbar, means it has to be L2. Second lumbar vertebra, L2. It itself is given. Level of body of second lumbar vertebra, stenosis most likely. Lateral it has to be L2 only. Lateral branch. Otherwise, renal artery, the left side renal artery is little bit above. It is up to in between L1 and L2, and right is also so lateral. Right one is little bit below, but it has not given. Celiac, it has to be at T12. Inferior mesenteric artery is well below. It is L3. Left renal is again at L1. Superior mesenteric is also at the level of L1. So it is second lumbar. That's why the question is and in middle sacral dividing this out is dividing at L4. Aorta division at L4 and inferior vena cava division is L5, and this middle sacral is L4. 40-year-old man is admitted to the surgical day case unit for repair of his left inguinal hernia. He is noted to have diffuse skin tanning. So tanning, spotty pigmentation, this is Addison's or Cushing syndrome, buttocks pigmentation. Operation becomes severe hypotensive. This is Addison's crisis. So Addison's crisis during surgery, what happens? Skin pigmentation, low blood pressure, gastrointestinal nausea, adrenal gland not produce sufficient steroid hormones, crisis, this syncope, convulsion, hypoglycemia, hyponatremia. So hydrocortisone has to be given suddenly, and this is adrenal insufficiency, not ATH. 19-year-old woman presents to emergency department profoundly hypovolemic, having fallen from the horse. The woman of 19-year-old fell from the horse, hypovolemic, shock. Posterior chest shows fracture of the middle third of the clavicle. This is the clavicle, this 1, 2, so middle third of the clavicle. It has got subclavian artery posteriorly. Here is subclavian vein just close to it. Then from here the branches subclavian artery is giving so here is subclavian artery directly. Which of the following vessels are most likely damaged? No any other branch is given. Subclavian artery is very close posteriorly to the middle third of clavicle. But rest of the arteries, brachiocephalic trunk is again medial. Left axillary artery is in the axilla. Vertebral artery is the first part of subclavian artery. It is immediately from subclavian artery, it is going up. Vertebral artery, it has to be here only. This is the scalus anticus. It is vertebral artery has to be very here. Yes. 65-year-old man present with all inguinal swelling in the groin which is non-tender. cuff impulse is elicited at operation and indirect inguinal is repaired. So the cuff impulse present, operation is the cremastic muscle. So there are three layers of the scrotum you have to understand. Outermost, this is the layer, outermost skin, then there is dartos muscle, external spermatic fascia and cremastic fascia. This is from the internal oblique muscle. External spermatic fascia is from the external, and internal spermatic fascia is from fascia transversalis. So external spermatic from external oblique, cremastic from internal oblique, and internal spermatic from the fascia transversalis. Three concentric layers. And dartos is the continuation of the subcutaneous carpus fascia, outermost. These are the layers. Then the testis. Testis has got their own layers. So this is coverings of the scrotum. 70-year-old woman is in recovery area and receives 28% oxygen by mass. Blood gas shows pH is very low, acidosis. PCO2 is high and PO2 is high. So this is PCO2 is very high, PO2 is, in spite of giving much oxygen, PCO2 is not improving. So sensations, chemoreceptors are insensitive. So if you see this figure, this is an important figure. Peripheral chemoreceptors, they are situated in peripheral chemoreceptors, or is called aortic and carotid bodies, respond to partial pressure of oxygen. So decrease oxygen, they respond, they cause glossopharyngeal and vagus nerve, they stimulate cardiac centers, they sympathetic increases to cardiac output, increases blood pressure. And chemical chemoreceptors in medulla are sensitive to CO2. They decrease in pH, increase in CO2 causes vasomotor center, stimulates sympathetic vasoconstriction, increases the blood pressure. So peripheral chemoreceptors are acting on depend on the oxygen and carbon dioxide, and central chemoreceptors depending on the carbon dioxide. 28-year-old man presents with a pain in left scrotum. Diagnosis of varicocele is made. Which vessel is involved? Testicular vein is there or pembriform? Testicular vein is from the left renal vein, and right side vein is opening into IVC. This question is coming right side in the IVC, left in the left renal vein. So any pathology, any tumor in this may lead to varicocele. This is dilatation of testicular vein. 60-year-old man who is heavy smoker presents with 10-day history of frank hematuria. Smoker is there, frank hematuria is there, prostate is enlarged, hemoglobin is normal, creatinine okay, PSA is normal, pathology. Now this is about frank hematuria, painless hematuria, painless smoking. So there has to be bladder cancer. Most common bladder cancer is transitional cell tumor. Smoking, dye industry and everything, because it has got epithelium is transitional epithelium. Squamous cell carcinoma of bladder has to be there when there is stone and all that. 35 present irregular mass in the right breast. Age is 34. Irregular mass. Clinical is malignant. Mother is died because of cancer. Grandmother ovarian cancer. Which gene is most commonly? This is BRCA gene. Breast cancer cases with the known mutation, BRCA2, BRCA1. Breast cancer without genetic mutation is this, and some percentages with known mutation, among that BRCA2 and PRC1. P10, ATM, P53 other. These are breast tumor suppressing genes. When there is mutation in this gene, It increases relative risk for the breast cancer. Again, age, menopause, nulliparity, obesity, hormone replacement. Moderate is age. Mother or sister with the breast cancer is moderate. High risk is BRCA2, BRCA mutations, and age. So BRC mutations is important. 65-year-old man presents with non-tender swelling in the right hemiscrotum. At operation, hydrocele sac is open 400 ml fluid, which anatomical structures around the fluid. So here you have to understand the layers of anomalies of tunica vaginalis. Let's go to this hydrocele insisted, this is communicated, this is non-communicative fluid. So tunica vaginalis, it collects in the tunica vaginalis. Two types of 25-year-old is brought to the emergency department following road traffic accident. "24-year-old man is brought to an emergency department for road traffic accident." Is brought to the emergency department following a road traffic accident. He has obvious airway compromise due to mouth facial hemorrhage, which requires surgical airway. The surface landmark used to localize the optimal site for the tracheostomy incision are midway between supraesternal notch. Which of the following? So, brought a compromised mouth hemorrhage, which require. So actually, the point is between this supraesternal notch and cricoid cartilage. The midway between that has to be taken. This is hyoid, thyroid, cricoid. Cricoid is lowermost. From this cricoid cartilage to sternal notch, the center of the transition made between the cricoid and the sternal notch. 40-year-old man has an anterior resection of the high rectal. Histopathology reports indicates Duke stage B. What is approximate average 5-year survival? Stage B is limited to mucosa and there is no lymphatic training, no lymph nodes involved generally, and so it has got good prognosis up to 70 years. One is 95, two is 70 to 80 years. One is limited to mucosa, second is not involving muscularis, this layer, not it up to the muscularis layer, and third is up to the serosa, fourth is beyond serosa and few lymph nodes. 20-year-old man to the emergency department after accidental tripping over the lacerating the hand glass bottle. On examination, 2 centimeter laceration of the hypothenar with loss of flexion distal pharyngeal joint. So distal pharyngeal joint is always, this is the distal pharyngeal joint, this is flexor digitorum profundus. If this is injured, that will lead to difficulty in flexion. 75-year-old who smokes heavily underwent coronary artery bypass grafting 6 months ago. The left internal carotid artery was used. Now complaints of angina and begging is laundry and washing. So stenosis proximal to first branch. What has happened? This is subclavian steal syndrome. This is arch of aorta. From there, this is vertebral artery. This is another vertebral artery. So whenever there is blocking here, the blood instead of going for right side, this has been already utilized into mammary artery. So he getting less supply because the blood has to flow in this manner. A beautiful diagram. 50-year-old alcoholic man presents to emergency department found to have been unable to extend the wrist. So wrist drop is there, thumb, fingers and hand able to weak extension of the right elbow is also unable to extend, drop, and loss of sensation dorsal of the first web space. So radial, the supply of the radial nerve is all lost. 50 patients with acute back pain, severe rotoreflexion, lack of dorsiflexion of the left ankle. Ankle dorsiflexion. It has to be again. This is ankle dorsiflexion. L4 root. L4, L5, S1. So L4 has to be there. No any other. There is L4. 20 mm dependent stab into the right chest. Pulse is 1 so whenever they stab, the first thing to secrete is renin only. Stabbed in the back of thigh, dividing popliteal artery, undergoing repair posterior. Which of the structures most likely to be got first is tibial nerve. Tibial is superform, then the vein, then the artery is deepest. 78-year-old woman presents with urinary urgency and continent external youth innervated by pudendal nerve. You see S1, 2, 3, this is pudendal nerve, it is supplying to the bladder. Inferior sympathetic is from here, somatic is from the pudendal. S2, 3 pelvic nerve. So autonomic control of the bladder. How is control? Contraction of the internal sphincter is visceral pain, parasympathetic from the retrosal somatic. 40-year-old woman presents with parotid tumor. For ages 40 years, perineural invasion means malignancy has to be there. Adenocystic carcinoma. 49-year-old man with assaulted sustained injury to the right side of the head. After 2 weeks, he notices dial his right eye. His right eye is dry and he could not produce tears. Which ganglion? So tear pterygopalatine ganglion. So here is ciliary is for this, and seventh nerve, greater petrosal, GP is supplying to PG to LG. It's like this. So oculomotor, olfactory optic oculomotor, oculo-otic, cranial ciliary, OCPS parasympathetic. 35-year-old man undergoes right inguinal hernia surgery with general anesthesia. Nerve is blocked for the posterior. Recovery is weakness of the right leg. Right leg weakness means it has to be the femoral nerve. So how is the femoral nerve? This one is obturator nerve. This one is lateral cutaneous nerve. L2, 3, 4. This is femoral nerve, and it is supplying to the muscles. So inguinal hernia surgery is near here. So muscles, femoral nerve. A man suffers brachial plexus injury. On examination, Horner syndrome. T1 is to the Horner syndrome. This is superior ganglion. This is middle, and this is T3 ganglion. So it has to be styloid ganglion. Sympathetic outflow upper limb is from second to fifth thoracic ganglion. Is fusion of the inferior cervical ganglion. This is inferior cervical and the first thoracic. So there is lowermost cervical, superior, middle, and inferior cervical is there. Lowermost cervical fuses with the T1 to form the styloid ganglion. A 60-year-old woman, breast carcinoma, complains of difficulty in chewing her food and in numbness of the lower lip. So what happens? There is metastasis and it has gone somewhere into the skull, and numbness of the lower lip. Lower lip is supplying from mandibular nerve. Upper lip is supplied from maxillary. So this is mandibular. Upper lip is from maxillary. This is coming from oval. This is from the rotundum. Which one of the following muscle is extensor of the hip? Now muscles which are acting on the hip. This is important. Most important is flexion. Iliopsoas, adductors, they are also helping. Sartorius, rectus femoris. Whatever muscles in the thigh in the anterior side are flexors. Whatever muscles are on the posterior side are extensor. The maximum is by the gluteus maximus. Biceps femoris long head is also. So this is hamstrings. Biceps is causing most of the time. Hamstring pull is there, that is biceps femoris laterally. Semimembranosus, semitendinosus, these are also extensor of the hip, or they are also called as hamstring muscles. So adduction is always by the adductor muscles, longus, brevis, magnus, and pectineus a little bit helping. Abduction is by the medius, minimus, tensor fasciae lati, and sartorius. Lateral rotation of the hip, adductor magna, sartorius. Medial rotation is medius. In order to expose right axilla, transverse incision typically made below the clavicle from the point of just lateral to the sternum joint. Which of the following structure would be encountered in the dissection down to the vessel? So here you are trying from the axilla, right axilla, transverse incision is typically made below the clavicle, just point lateral to sternal end. It is this sternal, just lateral from, you are going like this. Deltopectoral groove. Which of the following structure would be encountered? In this, the things which are you are getting injury is thoracoacromial artery, acromial branch. It has got acromial, dental branch, pectoral branch. So this is the thoracoacromial artery. So many branches are coming. Then superficial is you get cephalic vein. These are the things which can be injured. 55-year-old man presents to the emergency department after collapsing. On examination, pulse is 140 beat per minute. Pulse is 124. Blood pressure is less. Respiratory peripheral arteries are warm, which is most likely diagnosis of the patient. So warm peripheries, hypotension, there has to be some sepsis. So hypovolemia, systemic vascular resistance increase from the reflex, cardiogenic, again cardiac output less but increase resistance, neurogenic, everything goes down. In sepsis, cardiac output this is decreased cardiac output. In posterolateral approach to the posterior malleolus fracture, an incision is made between calcaneal tendon and the distal fibula. This is the fibula and calcaneal. Which of the following structure risk? So here if you see, this is posterolateral. Tendons are peroneus longus and peroneus brevis. These are the foot everters. So they are going down. From here the sural nerve is passing laterally and anteriorly superficial peroneal nerve. Dorsum of the foot, lateral of the foot. So posterolateral approach, sural nerve is. 25-year-old woman undergoes an elective right thoracoscopic procedure for diathermy applied to the nerve site lying anterior to the neck of first rib, which is like Horner syndrome. Just we have seen. Left knee reflex is reduced. Knee reflex. Now what is the knee reflex? It is extension L4, L3. Reflex roots. Remembering the reflex root. Now buckle my shoe. 1, 2, buckle my shoe. 3, 4, kick the door. 5, 6, pick up sticks. 7, 8, shut the gate. So 1, 2 is ankle jerk. Downward movement, ankle 2. Kick the door. 3, 4 is kick the door, means knee jerk. Pick up sticks, biceps and brachioradialis. 5, 6 pick up sticks. And triceps, shut the gate. This is fight position, biceps and brachioradialis, C5. flexion, pick up sticks. Kick the door, kick the door, 3, 4. 25-year motorcycle is admitted following a road traffic accident, sustained bilateral femoral fracture, rupture spleen, post-operative confused. What is there? This is a third post-operative. Severe hemorrhage has happened. Chest X-rays, diffuse lung infiltrate. So multiple organs has to be failed. Pulmonary has to be cardiac. Embolism has to be some severe chest pain. ARDS. On ultrasound scan of popliteal fossa, which investigation which of the following is the closest to the capsule? So it is deep is artery. 25-year-old man sustains a twisting injury while playing football, develops immediate swelling of the knee. Immediate swelling and delayed swelling. Immediate is cruciate ligament, delayed is meniscal artery. He is fully range of movement, posterior, positive anterior draw test. Test for tear in the cruciate ligament, tear anterior cruciate ligament. So this is anterior cruciate, can draw the tibia anteriorly, posterior cruciate, draw the tibia posteriorly. 62-year-old man requires a partial gastrectomy for large benign ulcer, gastric antrum, reaches the clinic 6 months, complaint of palpitation. So here is person 62-year, palpitation, weakness along the cramp-like abdomen occurs an hour after. This is called as dumping syndrome. Why dumping occurs? Hyperosmolar fluids goes into the jejunum, inappropriate hormone release, vasomotor symptoms are rapid glucose absorption causes insulin release. This is late. Early dumping is hyperosmolar. So this late dumping. Early dumping has to lie down for the symptoms subside. In septic shock, noradrenaline used to increase the systemic vascular resistance. It is alpha 1. So again, these are the drugs which are used. Dopamine, basic cardiac arrhythmias, that is basically for the cardiac. Dobutamine is again beta 1. Dopamine is beta 1 D2. Nitroprusside alpha 1. Epinephrine is beta 1. A 56-year-old man presents with acute epigastric pain, vomiting, examination guarding in upper abdomen. His tests are upper. This is serum amyloid is very highly raised. Which of the following is most likely etiology of the condition? So this is the question. It is not cholelithiasis, hypocalcemia. Etiology of the condition: alcoholic pancreatitis, biliary pancreatitis. Which of the following most likely etiology of the condition? A 47-year-old woman with end-stage renal failure requires electrocholecystectomy for symptomatic carcinoma. Her hemoglobin is 7.2. Which major cause of end-stage renal erythropoiesis? Erythropoiesis. This is the ureter which open on the posterior surface. 65-year-old man, colonic resection of carcinoma 12 hours, is now passing concentrated urine 0.5 ml. Endocrine response is most likely to have cause antidiuretic hormone. It is trying to retain to water inside. So ischiorectal abscess, the boundaries, if you see abscess is here. This is the lateral boundary, this is the medial boundary, this is superior and the skin. Lateral boundary you can see these are the levi-triani muscles, these are external and sphincters, these are the pudendal canal is on the lateral boundary. So abscess is medial to pudendal canal. So lateral to obturator internus. Here is obturator internus. This is levi-triani. This is external. So boundaries of anatomical snub box. This tendon, which is, if you see, keep the hand on the side, anatomical position, you get this is the medial side. So extensor, always it is extensor pollicis longus. Extensor pollicis brevis and adductor pollicis longus. It's not given here, and that's why it is Even extensor pollicis brevis is also not there. Extensor pollicis brevis would have been there. That is so. 55-year-old woman complains of cramps and tingling in her legs 48 hours after subtotal thyroidectomy. Whenever surgery, parathyroid is given. Parathyroid is accidentally removed. Patient gets hypoglycemia, and hypoglycemia you have to give immediate calcium chloride. Acute asymptomatic elemental heavy calcium. So here there is calcium chloride is there. Presents with fecal incontinence, anatomical intact internal and external sphincters. Which structure? So these are the nerves which is supplying to anal sphincter, rectal nerves, pudendal nerves, to puborectalis, historectally perineal muscles. So all these muscles, anal sphincter is supplied by pudendal nerve. Abdominal fluid which collects in the lower part of the peritoneal cavity at operation with patient supine. This is the supine position. This is collecting in the hepatorenal pouch, rectovesical pouch. Hepatorenal, this is the first. When the person is standing, it will be in the pelvis. 45-year-old homeless man, cough, weight loss and everything, body mass index has gone below 19. Cavitating lesion, upper lobe. Cavitating lesion means tuberculosis. Healthy 36-year-old man is assessed with a view to life-related kidney donor. Following investigation is inaccurate for measuring GFR. Most accurate, inulin and pH. For GFR, inulin is used for blood flow, paramagnetic acid. Why inulin is filtered at the glomerulus is neither reabsorbed nor secreted, therefore best to measure GFR. Paramagnetic is filtered at glomerulus and most of the removal is actively secreted in tubule so that 90% of the cleared of its pH one of the through kidneys. 34-year-old pregnant woman develops swollen leg. 34-year-old swollen leg. Mother and has similar problems. Which of the following? Antiphospholipid antibodies. So what is the antiphospholipid syndrome criteria? Sydney Sapporo criteria. What happens here is that vascular thrombosis, anti-cardiolipin, IgGM, IgN. These are the cardiolipin. So vascular thrombosis, pregnancy morbidity, anti-beta-2 and glycoprotein. So these are called antiphospholipid syndrome. Sometimes it comes as anti-cardiolipin, IgM, IgG also. Thyroglobin, nuclear, mitochondrial, these are different. 72-year-old alcoholic man is known to suffer from chronic obstructive pulmonary disease. COPD is there. He has been diagnosed carcinoma of urinary bladder. History of gastric canal, following agent likely responsible for the cause. Smoking is the commonest cause of malignancy. This is 3-year-old baby. The pancreas is developing from the two different diverticulum, which is around the second part of the duodenum. 78-year-old man present 3 by 4 centimeters swelling in the right groin, which is tender cough impulses elicited operation. Indirect inguinal hernia is found. Now you see indirect the external oblique is in the hernia is found. The external inguinal ring is defect in which of the following? There are 2 rings. It is also called a superficial. This is the external ring, and there is a deep. The deep ring is the fascia transversalis, super in the external oblique aponeurosis. 45-year-old woman suffers from spina bifida, confined to the wheelchair. Her legs are not fully developed. What is the? And there is hypoplasia. Pathology occurred in the legs. His legs are not fully developed. Hypoplasia. A 23-year-old man presents in the emergency department with non-specific chest pain. A posterior anterior chest performed normal immediately inferior caudal lobe of the aortic knuckle. Immediately inferior caudal lobe of aortic knuckle was further structured with a convex water. What is this structure? So this you can see aortic knuckle. Next to aortic knuckle is inferior. Immediately inferior caudal to outline of aortic knuckle is convex structure is a pulmonary trunk. You can see this is aortic arch, and aortic arch, there is inferior is pulmonary trunk, then you get left auricle, then you get left ventricle on the x-ray, and right ventricle is always on the base. Pulmonary trunk is below the aortic knuckle. 45-year-old woman presents to the hospital with jaundice. She undergoes ultrasound scan and is diagnosed of hepatocellular carcinoma affecting left lobe of liver. Which virus? Hepatocellular carcinoma is caused by hepatitis B infection. 82-year man has completed occlusion of inferior mesenteric artery on angiography. Complete occlusion of inferior. Which artery? Inferior mesenteric artery. This artery is occluded. So now what is the remaining artery? This is supplying to superior rectal and then left colic artery. This is the artery of Drummond. The superior mesenteric artery, this is middle colic and this is ileocolic, or you can call it as right colic. Right side is middle ileocolic, central above is middle colic. Ileocolic is supplying to appendicular as well as small bowel. So these are all small bowel mesenteric. Superior mesenteric artery, middle colic branch, this is the artery of Drummond. Marginal artery of Drummond, complete marginal artery of Drummond. So middle colic should be the answer. 56-year-old man documented type 1 diabetes mellitus with surgical outpatient patient, leg pain. He has no history of back pain. He has been smoking for 10 years. He states his alcohol consumption 30 units. On examination, signifying right foot pulses are weak, altered sensation dorsum of the foot. What is most likely diagnosis? So what is there? It is nothing but instead of femoropopletal, pulses are absent and dorsum of the foot altered sensation. So there is nothing else. Femoropopletal stenosis has given. 35-year-old man presents with 3 weeks history of low back pain and 3 days history of back leg. Physical examination demonstrates numbness or posterior aspect of left calf, extend to the lateral. Left ankle reflex is absent. Ankle reflex, it means S1. So here always there is compression of nucleus pulposus. 72-year-old man is who is smoker presents to a doctor with a second episode of frank hematuria, and urinary confirms solid lesion in the right kidney. So hematuria, frank mass in the kidney, it has to be carcinoma. Commonest is renal cell carcinoma. 20-year-old man presents with abdominal pain, shock, who is found to have hemoperitoneum, rupture spleen, denies the history of trauma. This spontaneous history, virus, Epstein-Barr virus, this is causing infectious mononuclear malaria, typhoid, generalized predisposing factor, direct trauma and all that. So HIV, measles, mumps, varicella is not common. EPB, Epstein-Barr virus. Even cytomegalovirus, if it is there, you have to think of that. 30-year-old woman presents to the outpatient clinic with 3 months history of diarrhea, which is intermittently bloody or rectal biopsy shown in the granuloma. Granuloma is Crohn's and ulcerations, and it is transmural inflammation, granulomatous, discontinuous skip lesions are there. Ulcerative colitis, mucosal and submucosal inflammations are there. Continuous lesion, crypts are there in ulceration. 56-year-old motorcyclist presents to the emergency department after being involved in road traffic as a smoker and known to have hypertension. He is conscious, Glasgow, continue maintaining overcast, found to have right femoral fracture, distal pulses sensation, resuscitation started, urethral catheterization, but over 60 minutes drain only 10 ml. Falling is most likely, means whenever there is major injury, fracture, and then output is less, either it is hypovolemia or it may is this person initially has got some output. If pelvis fracture is given, then we have to think of ruptured bladder and all that. 35-year-old man is pancreatitis leads to admission to the Surgical dependency on you. After 48 hours, he developed breathing difficulty with elevated respiratory rate. You suspect he is developing respiratory failure, which is following mechanism of regular respiration. So CO2 is stimulate that causes, that is the chemoreceptor basic start the respiration. TURP is done whenever there is stimulus. This nerve is stimulated. This is obturated nerve. It is causing the adductor muscles. So adductor muscle that causes twitchings. Which of the following statement is true with relation to the cardiac muscle? So what happens? This is the first thing is the stimulation of by influx of the cardiac calcium to the sarcolemma. The cardiac action potential starts. That is the main thing. 39-year-old patient with swelling left line. Investigation reveals radiodense confirmed to be in the ureter. And this is the ureteric stone. What is most likely composition of ureteric stone? Calcium oxalate is the commonest type of stone. Patients playing football is complain of the posterior thigh pain. You see, this is the ischial tuberosity. So sorry, this is ischial's lowermost part where person is ischial spine. From there, these are the hamstrings, semi-membranosis, semi-tendinosis, and biceps femoris on the lateral side. So that is causing pain, bicep femoral tear. 23-year assaulted stab injury to the left groin wound is pulsatile, simple tracing, abrasive operations, pulsatile swelling, there is aneurysm of femoral artery. Diastolic murmur audible in the second left is always, second left is pulmonary, right is aortic, ups point third and left intersternal border, and tricuspid on the right, left fourth, and mitral on the left fifth. 25-year-old man is admitted with stab in the inferior chest. On examination, he is alert, coherent, congested neck veins. Whenever congested neck veins, there has to be cardiac tamponade. 20-year-old suddenly with abdominal pain, imaging reveals right ovarian cyst. It is excised and many tissues are seen, means teratoma. Now lumbar puncture is done. Whenever there is bleeding, there are a lot of vessels, veins inside. If you get a bloody tap, it has to be the vertebral venous plexus. 25-year woman which has swelling in front of the neck, operated 2 years ago, swelling moves, deglutition means it is thyroid, and find amyloid stroma, serum calcitonin means medullary cancer. 75-year-old man, prostatic hyperplasia present to the emergency with urinary accretion, urinary catheterization, collapses, is allergy, latex allergy, immediate type 1 hypersensitivity. 70-year basal carcinoma rejected from the temple, and most important is how much it is excised. You can see basal cell carcinoma, tumor size more than pathology and recurrence. 60-year image, 6 units of Paxil blood test. Platelets are 40, INR is 2.2, fibrogen products are less, fibrogen has come down. What is the result? DIC, FDPs are raised. Statistic, the woman is given pre-admission, myocardial infarction, examination, she is atrial fibrillation. Recent echocardiogram shows dilated left ventricle. She is on warfarin and INR. 6.1 means warfarin inhibits which of the following? It acts on prothrombin. So warfarin acts on prothrombin, while heparin potentiates action antithrombin 3. It inhibits vitamin K reductase. Warfarin crosses placenta, heparin does not cross placenta. Reversal is by prothrombin complex. So that's why prothrombin is prothrombin PCC is given. PCC, prothrombin complex. Here prothrombin is given. It acts on extrinsic and common pathway, intrinsic and common pathway. Heparin is basically acting on intrinsic. APTT is done here, and here INR is done. 20 having uncontrolled labor pains, epidural and has to be given. Epidural space, also known as extradural space, contains numerous nerves and roots. Nerve roots, that is epidural space. 28-year motorcyclist presents in emergency department after being involved in route of vacation Radiograph shows segmental fracture of tibia and fibula. Intramedullary kneading of the tibia is undertaken. Pressure and complaints of severe calf pain. There is compartment syndrome. So raised intercompartment pressure is the pain, pain, pulse, pleural paresthesia, paresthesis. 65-year-old woman with the metastatic breast cancer admitted to the hospital is confused. Whenever metastatic breast cancer, calcium has to raise. So incidence pathophysiology we are not going to see. Recovery from varicose vein surgery, 35 complaints of weakness of dorsiflexion of the ankle. So plantar is S1, dorsi is has to be L5. So it has to be lateral compartment. Superficial peroneal nerve supplies to lateral compartment, everters. Deep peroneal nerve supplies to dorsiflexus. Supplies deep peroneal supplies to anterior muscles, dorsiflexors and ankle extensor. So deep peroneal nerve. These two, and there is loss of skin, lateral side and lower leg of the skin. So both these nerves. This is a common peroneal nerve. Common peroneal nerve. Superficial peroneal is the lower part, and sural nerve is just little part. So this area is superficial nerve, peroneal nerve, and this area is by the sural nerve, and this area is the deep peroneal nerve. So lateral compartment is supplied by anteriorly there is superficial peroneal nerve, and deep peroneal supplies anterior muscle like dorsiflexors and ankle, dorsiflexors of ankle and extensors of the, this is dorsiflexion, and toe extensors. This is the toe extensor. Dorsiflexion, toe extensor, that is common peroneal. 78-year-old woman with chronic obstructive becomes confused with right hemicolectomy. She is 30% oxygen. So what is there? Only two things is given. PCO2 is increased, PO2 is decreased. Type 2, both the thing is type 2. Lungs respiratory. Type 1 is hypoxia without hypercapnia. Hypoxia with hypercapnia is type 2. 19-year-old man fell down from the flight of stairs on presentation to the emergency department of Glasgow. Coma scale is 14. No focal neurological. An hour later, omitted. Glasgow 10 developed fixed dilate pupil on the left side. So, which of the following account pupillary signs? Compression of ocular, there is parasympathetic compression. If it leads to dilatation, skim dilation, autonomic innervation of eye, midbrain, pons, cranial of 3, parasympathetic root, ciliary ganglion, short ciliary nerves, they cause sphincter pupillary and ciliary muscles. So sympathetic chain, superior cervical ganglion, internal carotid, long ciliary ganglion, dilator pupillae. Parasympathetic is stimulated and is compressed, so that sympathetic dilatation because of sympathetic dilatation. 32-year-old mountain biker presents to the outline awkwardly extensive flexion of the neck. Neck flexion is there means upper cord is paralyzed. Neuropraxia has to be there. C5 nerve roots. 62-year-old presents with a firm irregular mass in the upper outer quadrant of the breast. Age is 65. Malignancy is there. Sentinel lymph node has to be the first. 50-year-old woman present with a history of fecal incontinence, then again pudendal nerve. 26-year-old woman present with emergency department with extensive bleeding from the arm, first injury, 7 centimeter. Again, this is ulnar nerve is lateral to median nerve. Brachial artery is lateral to median nerve. MBBR. Biceps tendon, radial nerve, brachial. 53-year-old complains of crushing chest pain. This is crushing chest pain. He has chronic hypertension. Pulse is 138. Blood pressure is normal. Principal cause reduce of coronary oxygen blood flow. Why oxygen blood flow is increased? Diastolic interval time. When diastolic interval time is less, physiology is bradycardia, tachycardia, poor cardiac output. Diastolic time interval, if it is reduced, that leads to 58-year-old patient with Brown-Sequard syndrome, right-sided meningioma. Features of, if it is in the brain and present is in Brown-Sequard syndrome, or it is meningioma of the spinal cord, the same side motor nerves are paralyzed. Right-sided weakness, proprioception. So this is meningioma of the spinal cord. 70-year-old woman present with fractured left humerus. X-ray shows osteolytic lesion. Histology examination sample taken for metastatic adenoma, which is most osteolytic. Only osteoclerotic is prostate. Epidemiology incidence at autopsy. Most common sites of lung primary is breast, lung and prostate. Symptoms especially 74-year patient with pulsatile swelling in abdomen, principal abnormality wall of cystic medial necrosis. 24 woman presents with swelling in the thyroid gland. She is enlarged lymph node, means papillary. 20-year-old severe head injury in the ventilator using positive pressure machine. Decrease cardiac preload. It decreases importance of positive pressure in hemodynamics. Decrease preload. Positive airway alveolar pressure increases lung volume. Compression of heart by inflated lungs. The interluminal pressure of the heart cavity rises. Venous return decreases. Preload is reduced. Stroke volume decreases. Cardiac blood pressure may drop. This is minimized with IV fluid, which helps to restore adequate venous return. Patients who are sensitive to change in preload condition, afterload lung expansion increases extraluminal pressure, which helps the pulmonary cardiac problem. So, severe injury, ventilator, positive pressure, which is the physiological consequence that will decrease the preload. So that is detrimental whenever you have a head injury and ventilation is there, that is decreasing because of increased pressure, increased volume. 70-year-old man with 1 week history of efficacy, profuse vomiting, hypokalemic alkalosis. Breathlessness, whenever breathing is there, it has to be from the intercostal nerve. Right and left pulmonary arteries are derived from which arch? Right and left pulmonary arteries. Sixth arch. Right and left pulmonary artery, ductus arteriosus from the sixth arch. Incus and malleus and tympanic membrane. Incus malleus, mandible, tympanic membrane, stapes styloid, second. In fetus circulation, blood passes from inferior vena cava into the right atrium. Inferior vena cava part the right atrium. Subsequently passes next into which of the following? From inferior vena cava into right atrium. So instead of going it down, it will go into the left atrium through foramen ovale. So this is a fetal circulation. You have to remember this. This is umbilical vein which is carrying oxygenated blood from placenta to mother and going it. And umbilical arteries is carrying deoxygenated from fetus to placenta. Placenta to baby is oxygenated blood. Again, distal intervention, for example, polycystic longus. A 39-year-old woman with large ovarian mass removed surgically required pelvic wall clearance. 4 days post-operatively complained of painful spasm in the groin and remarked that she has area of numbness on the medial side of the thigh. So this is the medial side of the thigh, only this much part. This is where the obturator nerve, medial side of the thigh. This is a little bit confusing, this is superior side, ilioinguinal is here, Iliohypogastric is also coming. Genital branch is here, and this most of the branches. Now, medial side of the thigh is obturator now. This one is obturator. Ilioinguinal, if it is on the pons and all this, it will be ilioinguinal now. 70-year-old patient is bound to have sodium 125. There is no signs of hypovolemia, plasma osmolarity, and urine osmolarity. You see, 280 is plasma and 1000 is urine. Osmolarity means concentration. Plasma concentration is less, urine concentration is more. It means ADH is, which of the following is best explanation? ADH is acting and trying to retain the fluid. Serum osmolarity decrease, urine osmolarity increase. Urine osmolarity is less, not indicating SIDH. Surgeon is carrying electrosplenectomy. You do, spleen is there, gastrosplenic is above, and splenorenal is posteriorly from the kidney. This splenorenal ligament. 45-year-old man established post-hepatic cirrhosis, palpable spleen forefinger. What is best likely? Thrombocytopenia, destruction of the. Then in classical cystic fibrosis, mucormyelitis and all that, this is increased with recurrent attacks of pneumonia. Newborn with mucormyelitis, ileus, this is one of the question, cystic fibrosis, malabsorption and all that. 42-year-old woman with cholesterol develops self-limiting post-operative infection. What is this? By the opsonization. After resection of rectal tumor, patient experiences erectile dysfunction. This is because pelvic splanchnic nerves. You see, these are the S1, 2, 3, pudendal, inferior hypogastric, pelvic splanchnic, superior hypogastric. Both they join to form pelvic hypogastric. Hypogastric for ejaculation, and lower is for the parasympathetic for the erection. So this is like this. Sympathetic shoot supply ejaculation descending with the respiratory, parasympathetic point supply S234 was pelvic splanchnic in the pelvic prostatic plexus. Now, 15-year-old girl has been treated for tuberculosis 6 months. She has presented to a doctor fatigue, appetite, increased pigmentation, adrenal, Addison's disease. 73-year-old man with a history of irregular bowel movements with dysuria, hematuria, and there is a communication of the diverticulum with the bladder. This is Hench's classification 1, 2, 3, 4. One is colonic inflammation related to paragloria. Second is pelvic abscess. Third is chronic peritonitis and fecal peritonitis. 30-year-old associated with the hammer sustained depressed fracture in the center of the jaw, and that is called the superior sagittal sinus. 57-year-old has cardiac rehabilitation. This is for increased atrial filling. Just remember, for atrial filling, you are doing this exercise for to increase the atrial filling. 9 meters renal shear renal transfer 2 years ago brought to emergency research proper analgesia would be the most likely adverse effect. Analgesics, painkillers had got decreased the renal perfusion. That's why NSAIDs are to be avoided. 77-year-old man is admitted acutely urinary retention, benign post-recurrent has free flow of urine, which of the leads to concentration of urinary loop of Henle. Impermeability to the water in the thick ascending loop is the countercurrent multiplier mechanism. Multiplier loop of Henle, it goes up and water is impermeable. Interstitial fluid of the kidney is gradually concentrated on the mechanism causes gradual osmotic outflow of the water from. So impermeability, it prevents. 52-year man is found to have multiple myeloma. X-ray shows appearance multiple osteolytic lesions. All are osteolytic except sclerotic is a prostate. 56-year-old man undergoes resection of the ileum. Which of the following effects is likely to be seen in patient post-operatively? Ileum is absorbed from vitamin B12, so vitamin deficiency has to be there. Previously healthy 45-year-old woman undergoes emergency splenectomy following traumatic subclavian venous pressure line to guide the distress equilibrium with the blood pressure. This decrease based on her left. What is most likely? During insertion, if the patient is in distress, it means there is tension in the thorax. Second proliferative phase of wound healing. Any wound healing, you need vitamin C. 19-year-old fell down from the skin. Presentation emergency department. Glasgow coma is 14.5. No focal. An hour later, he has deteriorated extradural. Now the extradural is right-sided also there and left-sided extradural. E1 is right-sided, B is left-sided. The same-sided pupil has to be fixed, dilated left side. The same side pupil has to be dilated first because of compression on the third nerve. It is lucid interval, blood trauma to the head, initial condition, lucid interval, brief conscious changes when unstable vital sign, patient become confused, sleepy, and pain. One pupil dilated may be coma. This due to herniation of and compression of the nerve. 70-year-old woman weighing 50 kg undergoes open cholecystectomy post-operatively. 24 hours later, she is agitated, confused, and her temperature is post-operative pain relief is administered by IV morphine. Morphine is respiratory depression. It has to be respiratory acidosis. Opiate-induced hypoventilation. So, what is lateral to femoral neck is femoral vein. What is medial to femoral ring is lacunar ligament. Pancolitis, arthritis, and everything is there except polyarthritis. It has to be monoarthritis, single. Why it has to be avoided? Non-steroidal because reduces renal perfusion. Which single respiratory test? FEV1 volume in 1 second, force expiratory is best in prediction of pulmonary after surgery. FEV1 if it is less than 1. Less than 1. A 58-year-old man admitted for England found to have enlarged heart shadow in the chest radiograph. Which one of the following statements is true? Is directly related to diaphragm. Enlarged heart shadow. Muscular one that thicker than left forms the apex of the heart. Right ventricle forms the directly related to diaphragm, base of the heart. 67-year-old man is admitted to the hospital with investigation of irregular heartbeat. The conducting system, which of the following anatomical structure? Even if SA node is there, it is not conducting system. SA node is initiating, but AV node is conducting. 28-year-old man is found to be in the sea by emergency. The alert, confused, core temperature is 30. So ECG changes which of the following changes? Here it is hypothermia, and you can't see the J wave option. So here has to be prolonged PR interval. 75-year-old man presents to outpatient clinic with 3 months history of painless ulcer on the sole of foot. Examination is obese, deep, first metatarsal, pedal pulses of conscious, hemoglobin. This is on the base, deep ulcer over first metatarsal head. Neurotrophic or diabetic. Assaulted, sustained 2 cm long laceration to the lateral aspect, physical, the laceration is the anterior malleolus. Laceration in anterior to lateral malleolus. Here is anterior now. That was posterior is sural nerve, anterior is superficial peroneal nerve. 48-year-old woman presented in emergency department, persistent diarrhea on examination. She was apyrexia, 48 beats. The most common cardiac abnormality. Persistent diarrhea. Diarrhea means loss, potassium is loss, hypokalemia. Bicarbonates are lost, so they are going to metabolic as this acidosis. 45-year woman is investigated after 2 episodes of renal colic, plain extra abdominal opacities in both kidneys. No abnormalities are found. Biochemical examination में adjusted calcium is not this much. Phosphate is normal. Alkaline phosphatase is raised. Increase alkaline phosphatase. Parathormone is increase. Alkaline phosphate is increase. Phosphate is normal. Primary. 35-year-old man develops septicemia following surgery for peptic perforated acute appendicitis. This is appendicitis. So perforated septicemia means metabolic acidosis has to be there. Acidosis there and metabolic means bicarbonate has to be low. These two things. Now, if CO2, oxygen is not in respiratory. If CO2 is coming down, it means compensation. But mix metabolic and respiratory acidosis. Even oxygen is less. That's why it's mixed. 75-year-old man is assessed for surgery. He has smoked 25 cigarettes. A 75-year-old man is assessed for surgery. He has smoked 25 cigarettes for a day and passed 45 short breath of minimal exertion. Widespread wheeze, hypertension, arterial blood gas is simple. Means this person is smoker, old age, COPD type, CO2 is high, bicarbonate high. Is adjusted with this. 18-year-old woman presents with recurrent tonsillitis, spontaneous skin bruising on examination, low lymphadenopathy. Recurrent tonsillitis, skin. What is most likely diagnosis? Aplastic anemia, pallor, signs of congestive heart failure, thrombocytopenia. 62-year-old woman presents with firm irregular mass in the upper quadrant of the right breast. This is shown to be malignant on mammography, and she is treated with wide local excision and axillary clearance. Which of the histopathological finding is better prognosis? So what will be there? You get malignancy, estrogen receptors are positive. It will be better prognosis. 58-year-old man is due to have surgery for dupuytren's contracture. Is released for the palmar. Which of the following regarding anatomy of the ring finger has cutaneous innervation from radial nerve? Yes. Ring finger actually it has cutaneous innervation from all three nerves. No cutaneous innervation median nerve. No cutaneous innervation. It has got cutaneous innervation from all three nerves. That is to be there. A ring finger is having cutaneous innervation from all three nerves. Passes deep in the confirms pressure of the thrombus in the common iliac vein and extend into inferior vena cava. Joins to form inferior vena cava at which fifth, and aorta is at the fourth level. 30 emerging involved root of action is temporal bone completely transiting the facial nerve just distal to proximal to genicular lacrimation. Which of the nerve or function of the nerve? Test sensation. Distal, okay. Just distal to genicular ganglion. Thirty-year-old motorcyclist in an emergency department road of accident. He has an open fracture of right femur. On arrival, he is tachypneic. Which of the following physiological is most likely to be seen? Bicarbonate level, it is metabolic acidosis. He has open fracture right femur. A 50-year-old man weightless for hip replacement and post-operative clinic, body mass index 41. Reduction of which of the volume capacity is risk most likely? Which of the residual volume? Functional residual capacity. A boy presents imaging 2-day history of headache, vomiting, drowsiness, CT scan reveals dilated both ventricles. This is the cerebral aqueduct. Excessive intravenous administration of the glucose will lead to hyponatremia. It is arising from arch of subclavian artery. Vertebral artery is arising from subclavian artery. Supraclavicular node is virtuous node. It has to be multiple just features. Peanut, it has to go down on the right lower lung lobe. 39-year multiparous woman admitted to smoke 10 cigarette per day with 2 lump in the breast. What will you advise? Brown discharge from the nipple, brownish nipple, mastitis, yellow discharge, ectasia. Now here a man is headache and vomiting deterioration over last 2 weeks with papilloderma. CT scan reveals homonymous hemianopia, optic radiation. It has to be behind. Atrial deprivation is seen by A wave. P first is P wave. 65-year-old man with ischemic heart disease, atrial fibrillation, present with paralysis. Right lower limb has to be anterior. Right lower means left anterior cerebral artery. Hypotensive found by atrial fibrillation. A wave is absent in fibrillation. Now this femoral artery, it has to be punctured at the midpoint of mid-inguinal point, not the midpoint of inguinal ligament. 45-year-old lady with insulin dependent confusion. She has been treated to 3 days and antibiotic for chest infection. Creatinine is high, most likely electrometabolic. So renal failure is there and hyperkalemia. Why? Abnormal pain, confusion. She has treated with antibiotic for chest infection. Creatinine is high. So any renal failure lead to hyperkalemia.